Hi, I'm Dr. EliWhitney with the Heart and Vascular Institute of Texas. Nerve and brain cells are very unique in our body in that they do not reproduce when they are injured and die. All of the other cells in our body, when they die, reproduce themselves. We actually get an entirely new skin every 2 to 3 weeks. We get a new heart every 4 to 5 months, and we get a new liver every 4 months. We get new red blood cells every 3 to 4 months. Since nerve cells do not reproduce, our body has an extensive nerve repair system that requires 3 dietary vitamins: vitamin B6, vitamin B12, and folic acid. The problem with folic acid is that it is not the active ingredient in the nerve repair system. Folic acid must be methylated in 3 steps to methylfolate, which is the active compound at the nerve level, along with B6 and B12. There are 2 groups of people that commonly have problems methylating folic acid: people with diabetes and older individuals. When people do not have the ability to heal damaged nerves, they develop peripheral neuropathy. The common initial symptoms of peripheral neuropathy is numbness in the toes, and as it gets worse, the entire foot. As it further gets worse, the numbness progresses up the ankles and the lower extremities. The next step in the progression of neuropathy is discomfort in the feet, which at first is present at night while lying down. Eventually the pain occurs all day long. The next step is even more severe pain and then total loss of feeling. When the neuropathy continues, the numbness can occur in the hands and descend up the arm just as it does in the leg. The problem with loss of feeling to the feet is that injuries can occur to the feet which are not appreciated. Since no pain is perceived, unrecognized infection commonly sets in and extends to the bones of the toes and feet. This leads to amputation. Diabetics who have had amputations are 3 times as likely to die as those without an amputation. Preventing peripheral neuropathy is extremely important to the quality and length of life. There are simplistically 3 types of therapy for peripheral neuropathy. The first are medications for the pain. Commonly used medications are gabapentin and Pregabalin, also known as Lyrica. These reduce the discomfort caused by peripheral neuropathy, but do absolutely nothing about the fundamental problem of the reduced healing system for nerve integrity. Tight control of blood sugar is very important in patients with diabetes. Tight control of blood sugar tremendously reduces the risk of developing peripheral neuropathy. The third therapy is supplements containing B12, methylfolate, and B6. These are the 3 building blocks of the repair system for peripheral nerves as mentioned earlier. I have a lot of concerns with over-the-counter supplements since the FDA does not require them to validate the contents of what they sell. I have had more people taking vitamin D and B12 in sufficient amounts to normalize blood levels, but when I tested them for blood levels, they were not receiving adequate replacement therapy. I recommend a pharmaceutical-grade supplement that has proven contents and results. PoDiaPN is easily available and it is not expensive. The cheapest way to get it is through a specialty pharmacy. In patients with diabetes, PoDiaPN 2 capsules per day will reverse the peripheral neuropathy 80% of the time. In patients without diabetes, PoDiaPN will reduce neuropathy about 50% of the time. Nerve cells heal slowly, and it usually takes 6 to 12 months for the improvement in discomfort to become manifest. It is very important when finding peripheral neuropathy to check for B12 deficiency, since some of the time it is due solely to B12 deficiency. This is also treated with PoDiaPN, but B12 levels should be tested yearly to be sure adequate levels are maintained. I hope this brief educational program has helped you understand peripheral neuropathy and why I may want you to take a pharmaceutical-grade supplement containing B6, B12, and methylfolate to treat it in addition to standard pain therapy such as gabapentin and Lyrica, and for those with diabetes, tight control of blood glucose is critical. I'm Dr. EliWhitney with the Heart and Vascular Institute of Texas.